Dear friends, I have a critical question for you today that could fundamentally change your understanding of a silent killer, one that impacts our community in profound and often hidden ways. Did you know there's a stealthy threat, a condition more deadly than breast, bowel, and prostate cancer combined? It steals over 11 million lives worldwide every single year. That's almost 1 in 5 deaths globally, a toll so devastating it's like losing the entire population of a country like Portugal annually to something most people have never even heard its name. We're constantly bombarded with news about familiar diseases, heart attacks, strokes, cancer battles. These rightly grab headlines, inspire charity campaigns, and spark awareness drives. But this insidious adversary, sepsis, often lurks quietly in the background, claiming millions of precious lives without us ever truly understanding its terrifying power. And here's why you, in particular, need to pay extremely close attention. Your life experience brings unique wisdom, but also unique considerations that make understanding this urgent threat absolutely vital for your health and the well-being of those you love. Imagine for a moment you wake up one morning feeling just a little bit off. Perhaps you're thinking, oh, it's just a common cold coming on, or I'm not as young as I used to be, a little fatigue is simply part of getting older. You might experience some mild muscle aches, a low-grade fever, and a general sense of being more tired than usual, seemingly dismissible symptoms for many of us, especially as we get on in years. So, you decide to take it easy, maybe stay in bed a little longer to rest, but then just a few hours later, something changes drastically. You might suddenly start shaking uncontrollably, your breathing feels harder and more labored, and a disorienting wave of confusion washes over you. You try to stand, but your legs feel like jelly, making you dizzy and overwhelmingly weak. By the time you or your loved ones truly grasp just how profoundly serious this rapid decline is, you could already be in a critical, life-threatening danger. That's the terrifying, almost unbelievable speed with which sepsis can take hold. This isn't some rare illness confined to hospital walls. Sepsis can affect anyone, anywhere. It doesn't care if you're a newborn baby in a remote clinic or a healthy adult enjoying retirement in a city apartment. It can shockingly begin with something as seemingly minor as a small cut on your hand, a routine urinary tract infection, UTI, a common chest infection, or even a simple case of food poisoning. It strikes in the wealthiest nations and the poorest, showing no favoritism based on age, gender, or background. And for older adults, the speed at which a common infection can spiral into dangerous sepsis can be particularly alarming. So what exactly is this invisible danger, this condition we call sepsis? In the simplest terms, it's your body's own extreme and life-threatening reaction to an infection. Think of your immune system as your body's personal army, tirelessly defending you against invaders like bacteria, viruses, or fungi. Now imagine that loyal army in a moment of grave crisis goes completely off course. Instead of just targeting and neutralizing the infection, your immune system unleashes an overwhelming and wildly uncontrolled inflammatory response that actually starts to damage your own tissues and vital organs. This massive internal inflammation causes your blood vessels to begin leaking, your blood pressure to plummet dangerously, and crucial blood flow to essential organs like your brain, heart, and kidneys decreases sharply, slowly, but surely beginning to shut them down. This is why you might hear it vaguely referred to as blood poisoning, but that phrase doesn't truly capture the intricate, devastating, and incredibly dangerous reality of what's unfolding within your body. Without immediate and extremely urgent medical treatment, the internal damage from sepsis can quickly become irreversible. If the condition worsens, it can lead to something even more severe called septic shock, a critical and profound drop in blood pressure that can tragically cause death in mere hours. Even with aggressive treatment, septic shock carries a very high mortality rate, sadly claiming the lives of up to half of those who develop it. But for those who courageously survive this ordeal, life often looks dramatically different afterward. Many people experience what's known as post-sepsis syndrome, a debilitating cluster of symptoms that can persist for months or even years. This can include crushing, relentless fatigue, troubling memory loss, significant difficulty concentrating on everyday tasks, heightened anxiety, depression, distressing nightmares, persistent muscle weakness, chronic pain, and even ongoing organ problems. Many older survivors describe feeling as if they've aged 20 years in just a few short weeks. This stark reality powerfully highlights why early recognition of sepsis is not just important, it is, without a shadow of a doubt, the most powerful and effective tool we possess to fight against this insidious and often hidden condition. To give yourself and your loved ones the very best chance against sepsis, you absolutely must be able to recognize its most critical warning signs. We have a simple, memorable tool for this, an easy way to remember the key symptoms. It's the acronym SEPSIS. Let's break it down right now, because knowing these letters and what they represent could literally save a life, perhaps even your own. The first S stands for slurred speech or confusion. This might appear as suddenly being disoriented, having trouble thinking clearly, or struggling to speak distinctly, representing a significant and noticeable change from your usual cognitive state. A is for extreme shivering or muscle pain, often accompanied by a high fever, making you feel profoundly and intensely unwell beyond a typical cold. P is for passing no urine all day, a critical and worrying sign that your kidneys may not be functioning properly. The second S is for severe breathlessness, meaning you are struggling desperately to catch your breath, even with minimal exertion, feeling like you can't get enough air. I is for it feels like you are going to die. This is not just feeling very sick, it's an overwhelming, primal, and undeniable sense that something is profoundly, terribly wrong, far beyond the discomfort of an ordinary illness. And finally, the last S is for skin that is mottled or discolored, appearing blotchy, pale, or even bluish, especially on your hands and feet. If you or someone you deeply care about has an infection, any infection, and starts exhibiting any of these alarming symptoms, this is not the moment to hesitate or wait to see if things improve on their own. This is the urgent call to immediate action. Sepsis is a true medical emergency, just as critical and time-sensitive as a heart attack or a stroke. The crucial difference is, with sepsis, you may only have a precious few hours, not days, to make that life-saving decision that could change everything. To underscore just how incredibly fast sepsis can strike and how easily its symptoms can be misread or dismissed, consider two vivid scenarios. Imagine a father of three, perhaps even a beloved grandfather in his later years, who seems to come down with what appears to be a bad case of food poisoning. He's experiencing persistent vomiting, uncomfortable diarrhea, and feels generally weak. His family might naturally assume he just needs fluids and rest, attributing his symptoms to a common stomach bug. But by the very next morning, he's confused, unusually pale, and struggling desperately for breath. These are classic, rapidly escalating signs of sepsis. In another scenario, a teenager, perhaps a vibrant grandchild, develops a high fever and muscle aches after a minor sports injury. Her parents might initially dismiss it as just a typical virus circulating. Yet that very night, she starts shivering uncontrollably and utters the chilling, unforgettable words, "I feel like I'm going to die." In both instances, these are undeniable sepsis warning signs, hidden in plain sight amidst common ailments. But if these critical indicators are overlooked, the outcome can be tragically fatal. What makes sepsis so uniquely treacherous is its chameleon-like ability to mimic many other common illnesses. In its crucial early stages, it can easily be mistaken for a bad flu, pneumonia, a severe stomach bug, gastroenteritis, or even just an intense migraine. This dangerous mimicry is precisely why so many cases are tragically missed until the person is already critically ill. And it powerfully demonstrates why widespread public awareness reaching everyone from highly trained medical professionals to everyday individuals like you and your family is absolutely essential in this relentless fight against sepsis. Once sepsis is strongly suspected within a hospital setting, healthcare professionals often spring into urgent action with a series of critical time-sensitive steps known simply as the Sepsis 6. These are not overly complicated procedures, but their immense power and effectiveness lie entirely in how rapidly they are initiated and completed. These vital steps include immediately providing high-flow oxygen to help the body, taking blood cultures to precisely identify the infection, administering intravenous antibiotics without delay, measuring lactate levels in the blood to assess organ function, delivering crucial intravenous fluids to support blood pressure, and meticulously monitoring urine output. Commencing these essential steps within just the first hour of recognizing sepsis can dramatically and profoundly improve survival rates. While anyone can fall victim to sepsis, certain groups face a significantly higher risk, and it's especially important to acknowledge that older adults, like many of you watching today, are sadly among those most vulnerable. Your immune systems, while still capable, may not react as robustly or swiftly as they once did. Other at-risk groups include newborns and very young children whose immune systems are still developing, pregnant women whose bodies undergo major immune changes, individuals with chronic conditions such as diabetes, cancer, kidney disease, or lung disease, those with weakened immune systems due to conditions like HIV, chemotherapy, or certain medications, and people recovering from major surgeries, severe burns, or significant injuries. Moreover, broader global health challenges also play a role. In areas with limited access to good health care, clean water, or antibiotics, infections are far more likely to progress to dangerous sepsis. Even in high-income countries, the growing and concerning problem of antibiotic resistance, where common treatments no longer work effectively against bacterial infections, significantly elevates the risk of life-threatening sepsis for everyone. For those who bravely conquer sepsis, the journey towards true recovery is often far from over when they finally leave the hospital. Many face arduous months, sometimes even years, of intensive rehabilitation to regain their lost strength, mobility, and cognitive function, and some may sadly never fully return to their former selves. Scientific studies tragically reveal that sepsis survivors face a higher risk of death in the months and years following their ordeal, alongside an increased likelihood of developing heart problems, kidney disease, and persistent mental health challenges. The profound ripple effect of sepsis also extends powerfully to families. Witnessing a loved one battle this harrowing condition can be deeply traumatic, and the emotional scars can regrettably last for years. So given this stark reality, what concrete and practical steps can you take starting right now to protect yourself, your partner, your children, and your beloved grandchildren from this relentless adversary? First, and most fundamentally, commit to learning the symptoms using the easy-to-remember SEPSIS mnemonic we just discussed. Make this knowledge a core part of your essential health toolkit. Second, act incredibly fast. If you or a loved one shows any of these worrying signs in conjunction with an infection, do not delay for a single moment. Treat it as an absolute and undeniable medical emergency. Dial your local emergency number immediately, whether it's 999, 911, 112, or whatever emergency service is used in your country. Do not wait even a moment to see if the situation improves on its own. Time in the context of sepsis is quite literally life. Third, if you are already at a clinic or hospital, perhaps because of an infection, and you start to feel unwell in a concerning way, be direct and empower yourself. tell the staff clearly and firmly, "I am worried about sepsis." That simple, powerful word can dramatically quicken their response, ensure they consider sepsis as a possibility, and ultimately lead to you receiving the urgent and specific care you need. Fourth, become an active ambassador for this critical knowledge. Share what you've learned today with your family, your dearest friends, your neighbors, your community groups, your bridge club, anyone who will listen. Awareness in the crucial case of sepsis spreads like a positive ripple effect, and that ripple, without exaggeration, absolutely saves lives. Beyond recognition and rapid action, there are also proactive steps you can take to significantly reduce your general risk of developing infections that could potentially lead to sepsis. These include diligently staying up to date with all recommended vaccinations, consistently practicing excellent hand hygiene, properly cleaning and caring for any wounds or cuts you may have, seeking early medical advice for any infection that appears to be worsening or isn't clearing up as expected, and diligently managing any existing chronic health conditions with the ongoing help and guidance of your trusted healthcare provider. Always remember this vital truth. Sepsis is a ruthless global killer. It shows no partiality. It does not care where you live, how many candles graced your last birthday cake, or how robustly healthy you've been in the past. However, and this is crucial, it is fundamentally treatable, but only if it is identified and addressed swiftly in its earliest stages. You don't need a medical degree to be a lifesaver in this particular situation. You simply need to recognize the unmistakable signs and act without a moment's hesitation. If there is just one singular message I hope you carry with you from this entire video, it is this: never, ever ignore sudden, severe symptoms when there is an infection involved. Always, always ask the life-saving question that could genuinely mean the profound difference between life and death for yourself or someone you love. Could this be sepsis? That single critical question posed at the right crucial moment can rewrite the future. Thank you for investing your valuable time in watching this vital information. Please take just a moment right now to share this video with at least one person you care deeply about, and then kindly leave a comment below to let us know you've done so. Because here, awareness truly is contagious, and in this unique instance, it's precisely the kind of contagion that saves precious lives. Your attention and willingness to share today could be the very thing that protects someone tomorrow.